I have people who are begging, and in clinical medicine, sometimes you have to make exceptions.
Of
And
course,
so
right.
I have,
But you're quite convinced that in the vast majority of cases, these people are gonna win the battle based on their immune system.
that's a well-established fact.
Okay. So now go on, the rest of the protocol.
So now you have so anyone who has shortness of breath, regardless of their situation, I'll treat because that's a dangerous symptom.
So even for a young person, if they have
Yeah.
shortness of breath, you're gonna go right to the
I'm gonna hit 'em hard.
You're gonna hit them hard. You're gonna hit them hard with the hydro, with the Z-Pack, and with the zinc.
The Z-Pack is a dose schedule. I would
It's five.
prefer,
It's like five pills, right?
right. I use a different regimen. Let's refer to it as Zithromax or azithromycin. That's
Okay,
more accurate.
Zithromax, and what do you give them of Zithromax?
500 milligrams, one pill a day for 5 days.
And then what about the hydroxyquinone? How much of that do you give them?
I use hydroxychloroquine, 200
Chloroquine.
chloroquine, 200 milligrams twice a day for 5 days. That is a slightly lower dose than what is being used in the ICU. In the ICU, the first day they use 400 milligrams twice a day, and then they go to 200 milligrams twice a day. What I do in the outpatient setting is use the lower dose of 200 twice a day from the very beginning. For now,
Why do you do that?
because this is the art of medicine. We want to have maximum benefit with minimum side effects. So I thought that since these patients are not critically ill, it's reasonable to use more moderate dosing.
Would you change that if you saw very serious symptoms?
I'm actually, this is all, Mr. Mayor, you have to know that this is all new, and I'm developing this stuff as I go along. This is like battlefield medicine. I'm giving you a report from the front
And I
line.
really appreciate this, that you're doing this. You're really helping a lot of people. But I guess the question was, are there any times you vary that 200 milligrams?
I'm beginning to vary that. Well, I haven't yet, but I want to vary it in the older population that are sicker, because I think they need to be hit harder to prevent them from going to the hospital.
And the zinc, is there any dosage of that you would do?
I use 220 milligrams
And how often?
once a day
For 5 days also?
for 5 days.
So after 5 days, do they come back to see you and you see what kind of condition they're in?
So first of all, I'm practicing medicine remotely. I have some medical issues myself, so my doctor doesn't let me. I have to be quarantined myself. But so I'm practicing via, FaceTime or whatever. And I have a whole team of PAs and nurses, and they're acting. They're seeing patients with me and carrying out my orders.
So if let's say you were to examine me, you would do it with like a telemedicine. That's why you're so familiar with being on the FaceTime.
You're right.
You're on there all day.
Yes.
So you look at me. I describe my symptoms to you. I send you my vital statistics.
Well, actually, my nurse does. You're there. Right?
So your nurse will visit with me while I'm talking to you,
Yes.
and then you'll go through all the things. And now you determine that I have some symptoms. I'm 75 years old, so you then prescribe for me the let's call it the regimen, right?
Yes. I call it the cocktail. But,
The cocktail, that's good. And then I have the cocktail 5 days, and then I get back to you and I say, I'm feeling better. That's good, right?
I also have my office follow up. I mean, since this is all experimental, I try to keep a close follow up on these patients to make sure that they're.
So in that 5 day period, do you follow up on them and see how things are working?
Yes.
And then is the 5 day period at the end of it? Is it sort of the telling point where you either see improvement, no improvement?
So let me define success in this case. Not to die.
Wow.
See, that's how I'm defining.
Okay, so we're into the 5 day period now. I call you back and I tell you, doctor, I don't feel any better.
I said, well, because you're talking to me and you don't have a pike in your throat, that's a good sign.
And you give them nothing else after that.
Depends, you know.
Might you
depends
give them more?
I could.
Can I get a few more cocktails, doctor? A
The
few
truth
more. I
is,
just need a few more cocktails, doctor.
I know what you mean, but I haven't. Only in a few patients. Most of them have responded extremely well.
So how long now? What's the longest streak you have with a patient so far?
I don't understand.
How many days? How many days? Your first patient.
Tuesday was last Tuesday.
So last Tuesday. So we're talking about basically 8 days, 7 or 8 days, right?
Let me give you some statistics.
And that's a critical period, I might add, right? Basically, am I correct that if you're elderly and you're going to get hit hard with this, it happens within that first 2 to 5 days, right?
That's correct, and it's vicious.
And very, very few situations, if you get through those first 2 to 5 days with no symptoms, and there's no intervening infection, you're probably okay.
Correct. And by the way, it's not going to take away your fever. You're still going to be coughing. You're still going to be tired. You're going to have a headache. You're going to be upset. You're going to call me. It's not working. But I'm looking at it differently. If you can call me, that's a good sign.
Well, so what you're saying is this cocktail really cures the illness. It doesn't relieve the symptoms.
Well, let me tell you what I believe it does. It reduces the amount of virus that the body is infected with by interfering with its growth, giving the immune system time to overcome it before it destroys the lungs.